All right, this is video 3 of Gastroenterology, week 1 and 2. Dr. Shabbos here, and I'm starting off, I believe I'm on page 16 with the Zollinger-Ellison syndrome. I've never had a case of this in 15 years. You just don't really ever see oversecretion of acid in the stomach, but it could exist. And one of the things they do when you're looking, if you run a test for excess acid, there's a test called a Heidelberg test. And they have a little device, a little capsule that actually can measure how much stomach acid. So you do a kind of a challenge test. They put it in, you swallow it. Sometimes it's on like a little string. Sometimes it just goes through. They catch it on the stool, but you swallow it, okay, and you typically want to keep it in the stomach because you get a baseline, no food. Then you eat food, and they see how much acid's released, and how it changes over time. It kind of little signal is sending back to a little readout. Or depending on the device, they may have to download the device once they get it out. So that's a test. They can determine how much acid's in your stomach. But obviously, if you have too much acid, it's going to be a serious issue. You have lots of risks, more risk of ulcers, more risk of GERD, all right, bleeding. Okay, so this is something you'll probably know, but you see that it's sometimes related to this triad of hyperparathyroidism, pancreatic, and pituitary tumors. So they'll probably have some other issues going on as well that will be investigated. Gastric cancer, keep this in mind. Anytime you irritate a cell, you keep poking it, poking. This in almost anywhere in your body. Prostate is my favorite example, right? Where it starts with inflammation and you keep irritating. Eventually that cell is going to become cancerous, right? The more you keep irritating it. So just think of that. If you have gastritis, cells that are irritated, irritate them long enough, they're going to change into something that are not gastric cells. As with all cancers, it's a lot of things you don't catch until so far in its development. So pay attention to any kind of bleeding is always an issue. Weight loss when it comes to cancer is always an issue. In any cancer, weight loss is an issue. Blood and stool, emesis, decreased appetite, weight loss, fatigue, anorexia, and anemia. And a lot of times when people, anorexia, why is that? Because they feel so poorly, they just don't want to eat, and that's going to contribute to the weight loss. So, when you don't feel really good, you just don't want to eat. Yeah. More common in men than women. Endoscopy with biopsy, right? Whenever there's cancer, what's the definitive thing is you always want to biopsy it and take a look at those cells and see what they've changed from. So, and if you can get a border, so you can see actually the progression from here's good cell, not so good cell, cancer cell. You can see the transition. Surgery, chemo, radiation. Okay. Small intestine. Food sensitivities, allergies. So we're going to talk about this food sensitivities, leaky gut, malabsorption, kind of all in one topic here. So I want you to understand what's going on with leaky gut. And what came first, food sensitivities or leaky gut? What came first, leaky gut or malabsorption? Okay, so here's what generally happens, just so you have a good understanding of this. And read through this here, but this is kind of important. So let's say you are stressed. Let's go back to the beginning. You're stressed. And because we got to paint a picture. I always paint a picture for any patient that comes in. So you got to get a good history. And they come in and they're stressed. Their complaint is maybe loose stools, or, I don't know, I always have pain in my stomach, or I always bloat it. Okay, and you get a history and you find, oh yeah, I got a lot of stress, I just got divorced or whatever's going on. So right then and there, you know that there's probably high cortisol. High cortisol has its own list of side effects, but that causes a thyroid imbalance. And the thyroid, specifically the active thyroid hormone T3, regulates the release of stomach acid. So just on what they've told you already, I've got stress, I've got this bloating, they're not making enough stomach acid more than likely. So we know that, and they might have GERD. They might not, but they might. So we know that their stomach is not making enough acid, not breaking down the food. The food, they still get hungry, then they eat. Okay, but remember, parasympathetic system is turned off when there's stress. The food eventually does trickle on into the small intestine, so it gets in the duodenum. But it's not broken down enough, as it should be. Right? Yeah, okay, so digestive enzymes aren't being released at the rate they should be because there's stress and low thyroid function. So now the small intestine's working on this food. And it's taking longer than usual in the small intestine now. So the food is sitting there longer than it should. And what happens when food sits there longer than it should? It starts irritating the lining, this very sensitive one-cell thick lining. The cells become inflamed. When the cells become inflamed, they swell, and the connections that hold the cells together kind of start stretching apart. And now there's a gap between the cells. Typically, when you eat food, the food gets broken down into very small little molecules that are transported across the cell membrane into the cell lining the digestive tract, and then it's transported out the other side of that cell and then into the bloodstream. So it's got to be small enough to pass through two cell membranes. With leaky gut, you got this space between the cells. Now any particle, big particles, can get through that lining, through that space, and into the bloodstream. That's leaky gut. Now it's in the bloodstream. Okay? Now, it's not necessarily the food particle that caused the inflammation. It's just there's too much food in general. But that particle, let's say it was avocado. Okay? Piece of avocado gets through into the bloodstream. Now your immune system says, hey, what the heck is this? I'm going to make antibodies. I need to destroy this. So then you get a blood test to check the IgG and look for the antibodies to find out, well, what are you sensitive to? And they're going to find avocados. And you think, oh, well, avocados are healthy. Am I sensitive to avocados? Well, no. It's just that avocados were there. They had opportunity to get through the cells into the bloodstream. Doesn't mean avocados were the thing that caused the inflammation to begin with. So you have to keep that in mind. If someone comes in with a food sensitivity test and they say, look, I'm allergic or I'm sensitive to all these foods, and you say, well, probably not. Probably these foods were present at some point when you had this leaky gut and they got through into the lining, into the bloodstream, and your body made antibodies. Doesn't mean that that's what caused the issue. All right. So then when enough of these things, if a lot of these things get in the bloodstream, your immune system goes crazy, right? It's very hyperactive. And that's when we start getting lots of signs and symptoms. Foggy brain, joint pains, okay? Unexplained skin rashes, right? So this is how it starts. So food sensitivity test, what is it really good for? The level of leaky gut. So if there's a lot of things on there, it could say, well, there's just a lot of inflammation. If there's only a couple things, it's pretty minor. So initially, a lot of times I don't have people spend the money. These tests can cost $200, $300, $400. I'll just start moving forward with a treatment plan. Let's just check. Let's just move ahead with what we would do anyways. Okay, because that just makes more sense than having to wait for a test, getting results that are maybe confusing. So just something to keep in mind when you're having this whole situation with leaky gut. Now I put a couple of, I think one video and some reading material extra on the website on leaky gut because it is going to be one of the more common things you're going to be dealing with individuals. Okay, and we'll talk about treatment strategy when we get done with this lecture. Okay. All right. So just keep that in mind, right? That could be what's going on. So there's a lot that's involved to get to that point. So it's all got to be fixed. Again, so what does this lead to? Well, malabsorption. Okay, because now you're damaging the lining, and if the lining is damaged in that small intestine, you're not going to absorb your vitamins and minerals, the proteins, fats, and carbohydrates. So you need to follow through. Some of those things you find out on blood tests or other different types of tests, and if you see there's not enough protein coming in based on what you're seeing on a blood test, there could be some damage to that lining. And they're saying here B12, K, B2, D and calcium, protein deficiency. Yep, right there. So obviously, yes, if someone can't gain weight or if they're losing weight, there's probably an absorption issue, right? If they can't gain weight, something going on. Or lots of diarrhea, right? A lot of food is just passing right through really quickly. Could be. If they don't have their gallbladder, like we talked about previously, what's going to happen with fats? Fats are going to kind of just go right through. You're not going to absorb them. You could have some loose stools. Treatment, same as leaky gut. Okay, and I'll go over this in a minute. And just the protein. Back to the protein. If I look at someone's blood test, how would I know? What would be my just a basic CBC chemistry panel? What would be my first or two things that I would look at that would tell me they're not getting enough protein? Okay, well the first one would be the BUN value or the blood urea nitrogen. If that's low, all right, if it's under 13, it's probably some kind of lack of protein being absorbed. Okay, that's one indication. And then you go usually further down on that list right there, you'll get to where it says total protein, albumin, and immunoglobulin. Immunoglobulin will show up first as very low or very low end of the range. And that's a good indication there's not enough protein coming in. Your body will, remember, your body is always trying to keep in balance. It'll take from one place to use some building product. So if you don't get enough protein intake, your body's going to take, well, I'll take a little protein from the heart muscle so that I can fix the liver. Oh, okay, now I got to take a little from the liver to fix the kidney. Now I got to take a little. Your body's constantly rearranging, and it will set priorities. So the priority will be, well, I got to keep the heart going. Okay, so what is one of the first things that we see go down? The immunoglobulins, your immune system, right? Those are proteins. So typically I'll see those go low, right? Because your body's not getting enough protein. So I see this with people who are like vegetarians. take a look at your immunoglobulins. Oh, you're on the low end. Why? You don't get enough protein. And it's fine up to a point, and then you're going to start getting sick more often. Because that's one of their lower priorities. Your body's saying, okay, well, I'm not fighting anything right now, and I need protein for my heart and my liver and my kidneys, so I'll let the immunoglobulins slide. So the blood test gives me a lot of information about what's going on. All right, lactose intolerance. People usually figure this out on their own. Celiac disease. For the most part, if people will usually know if there's a problem with wheat or not, but if anybody comes in with a digestive issue, I'm not going to test. I'm just going to clean up the diet, and I'm going to say no dairy, no wheat, no soy, and let's just start with some really basic foods we know don't cause any problems. A lot of times I try to move forward without spending a lot of time or money on tests that are not going to give me information that's going to change what I do. Okay. But if someone has issues, or if you have a child, this is probably where I would do a test. You'd like to find that out early in their life if they have this issue. If they're not growing, they're not meeting the different steps in development, you definitely would want to be something you want to check. And in this possible complications, if a person has one autoimmune issue, they might have another. This kind of goes back to what I was just saying about the immunoglobulins, right? So if you're running low, your immune system is just really not working that well. You have a lot of stress. You're not getting enough protein. We start seeing people get one autoimmune issue after another. On SIBO. So this is something I want to explain here because this is important. I want to explain exactly what's going on with SIBO. Okay. All right. SIBO. Small intestinal bacterial overgrowth. So first of all, keep in mind, where should all the bacteria be in your digestive tract? It should be in the large intestine, in the colon. Okay? There's some throughout the small intestine, but most of it is in the large intestine. Large intestine. So the problem is when that bacteria makes its way into the small intestine. So how does that happen? Why does it happen? So the most common scenario is this. Okay, and this is important to understand so you can explain it to somebody. In your digestive tract, you have something called peristalsis. You eat food, swallow it, and you have this muscle contractions that go along down through the esophagus, stomach, and all through the small intestine, large intestine, where the muscles contract in this sequential order and move food along, okay, and expels it out the anus. Okay, that's pretty straightforward. Everybody understands that. What people don't realize is that in between your feedings, in between your meals, in between you have food, so you eat breakfast food is moving along. Coming behind that peristalsis is something called a migrating motor complex. Migrating motor complex. All right? This is another wave, like peristalsis, that is going behind, and think of it as the sweepers in the street. It's going behind and doing cleanup duty. It's sweeping up everything, moving it along, and out into the large intestine and out. That happens in between. So if someone is eating a very poor diet, or they like to graze, so they're constantly eating, okay, and eating junk, this migrating motor complex doesn't have an opportunity to do its job. Okay? So what happens is, because that's not cleaning up, pushing things out, the bacteria, which is sitting in the large intestine, can kind of retrograde through that ileocecal value right down there by the appendix and creep into the small intestine, because that migrating motor complex isn't coming behind and sweeping it out. So because of that, you're giving an opportunity for that bacteria to move up into the small intestine. So that's how this process starts. Now, once it gets a foothold, it gets kind of hard. Now it's there and creating this bloating, causing irritation, right? Person always feels uncomfortable. All right. So how do you go about fixing that? Well, you've got the bad bacteria in the small intestine where it shouldn't be. Okay, it's gotten a foothold. And you can see the treatment there talks about oregano, berberine, wormwood. Some of these protocols include, garlic. So that's the typical kind of naturopathic alternative treatment for this, along with a cleaned up diet. The thing is, I've had dozens of cases, and rarely do I see this type of treatment work very well. And if it does, it takes an extraordinarily amount of time and frustrating, right? Usually for the patient. Typically, when it comes to SIBO, I am usually suggesting the antibiotic treatment, because there's a handful of things that I typically don't mess around with when it comes to treating somebody, when it comes to antibiotics. Okay, and the first one on top of the list, any doc's list, is strep throat. You don't try to do acupuncture or herbs. They need an antibiotic. Second one is UTIs, urinary tract infections. You can take as much cranberry or D-mannose, all those things you want. Person's pretty uncomfortable. You really want to fix this pretty quick. Antibiotic. SIBO. Person's pretty miserable. It's best just to do the rifaximin, 550 milligrams, 3 times a day, 14 days, and done. It typically works pretty well. Some people might need a second treatment, but it really works pretty well. You can go on for weeks and weeks with the oregano and the berberine and just never really knock it out. So, up to you, the level of bacterial overgrowth that they might have. Each person's different. How long has it been going on? If they've been through several rounds, if you want to do a round of the alternative treatment first, and you did it once or twice, okay, it's not working, okay, let's just go with the rifaximin. All right? So just keep that in mind when it comes to, how you're going to deal with this particular situation. Just to get it over with. And then follow up with the, SIBO diet. Basically, any improved diet compared with day round is probably going to be effective. But, this is just an example. There's many websites and links you can find diets that are all laid out for the SIBO patients. Large intestine, Crohn's disease. Here's the thing. I'll just mention this about, you can read through this. Crohn's disease and ulcerative colitis. These are favorite medical test questions. So what's the difference between Crohn's disease and ulcerative colitis? What's the couple main points? Well, Crohn's disease, the first one you always have to remember, it's from the mouth to the anus. It could be anywhere along that way. Usually, I only ever see it in the large intestine, but it could be anywhere. The other big issue is that, remember, the Crohn's disease can penetrate all layers of of the intestine. Again, penetrate all layers. The ulcerative colitis is just that mucosal layer. That's what gets irritated in ulcerative colitis. Okay, so if you remember those differences, that's really the big thing you'll see on a lot of tests. And then minor things like the skip lesions, because it's not like consistent. You'll see a little piece that's fine, then here's irritation, and then piece that's fine, then irritation. Crohn's disease is typically managed if you figure out, you clean up your diet and you figure out what your triggers are. It could be alcohol, it could be chocolate, spicy food. If you figure out what your triggers are, and people who have it typically find that out, you probably do pretty good. Most of the people that I've had contact with. And ulcerative colitis, interesting enough, I've had a handful of cases. Haven't had any in the last probably 7 or 8 years. Used to have more. I think part of the reason is that there are new drugs out that kind of keep this in check. Okay, I think that's part of the reason why I haven't seen a lot of this. Because I did early in my career. I had quite a few people. So my interesting note about this is that every single one of the cases I had, they were all young. They were all between, I would say, 19 and 26. And when they were diagnosed. Okay, when they were diagnosed. And right before they were diagnosed, every single one of them had some very major stressful event. I do remember one of them, a young man, parents got divorced. It was tough. The other one was a breakup with a girlfriend. Early 20s, very emotional. And then the one that I know I spent a lot of time with, he joined the Air Force, and he was in his like 3rd week or 4th week of basic training, and it was just too stressful for him. And he was diagnosed with ulcerative colitis. He became ill. So there's always been some kind of stressful event that's led to the triggering of this issue. Remember, everybody's maybe more prone to a particular autoimmune issue. These people, ulcerative colitis, I might be lupus, or you might be rheumatoid arthritis. And if you let your immune system crash enough, that autoimmune issue that you're more genetically prone to could rear its head. So as long as you keep your immune system in check, and this is kind of called like epigenetics. That's a whole topic too. That's really interesting. All right, hemorrhoids. Kind of a sensitive thing. Most people do over-the-counter things which will work. That's not solving the problem. In the past, I have done cauterization for external hemorrhoids, which works. Internal, they may need some kind of surgery. Obviously, you want to improve their diet. Are they straining too much? Is there a lot of stress? Is there, remember, there's that liver issue. Is there that portal hypertension, which is putting pressure back on the whole venous system? Right, something that might be part of the issue. Let's improve the liver flow, blood flow through the liver. So fiber and hydration. I can't stress hydration. Most people do not drink enough water. They say they do, but most people really don't have any concept of drinking a half a gallon to a gallon of water a day. They really, really don't. So depending on how how well you know your client, it's kind of an intimate physical exam. So, all right, hepatitis. A is what you get from fecal oral route. This is what you get when you go to the salad bar and the food service worker didn't wash their hands. That's why the signs are in the bathrooms. Employees must wash their hands. This is what you get from that. Vaccine, and I noticed here, what did I see? That children Most people recover in 6 to 9 weeks. Okay. No lasting liver damage. So even if you didn't get the vaccine, you would recover from this. So raises the question, because nowadays, and there was no vaccine like when I was a kid, okay? This is another one of the things they've added to the list of vaccines for children. Typically, children get it within their first 2 years. Okay, first 2 years. And it takes 2 doses, 6 months apart. So it's 2 shots of this vaccine. And remember, depending on what you're having your child do, are they being exposed? Are you washing your hands? You have good hygiene? Do they really need the Hep A vaccine? I don't know. Like I said, I didn't have it. I was a kid. It wasn't around. It's maybe something I think maybe could wait till later in life. It's only good for 10 years, I believe. Every 10 years, you should get a Hep A vaccine. If your immune system's healthy, like I said, you'll probably recover just fine. Hep B, on the other hand, pass through blood. So this is the vaccine that you need to get if you're a healthcare worker. I had to get it. I don't know if you guys have to get it for working in the clinic, because you might come in contact with your patient's blood. So the vaccine is 3 shots. I think it's 1 shot every month for 3 months, something like that. So it's a 3-shot series. Okay. Hep C. This is probably one of the most dramatic things in my career as a physician that I've seen such change in. Because when I first started as a physician, and you're going back maybe like 15 years, I had a lot of Hep C patients, because the traditional treatment for Hep C was some very horrific drugs that had a lot of side effects, really damaged the liver. Even more taking the drug. It was just kind of one of those kind of crazy things. But the other side effects just were a lot to handle for a person. So people sought out alternative treatment, which was very frustrating because it was hard to do. I would say, I don't know how long ago, 5 years ago, maybe not even, there is now a whole series of new designer drugs out there that can knock out Hep C in 3 months. It's usually a 12-week protocol. The one that I'm most familiar with, I think that came out first, was Harvoni. It's oral. You take it once a day for 12 weeks, and Hep C is gone, undetectable in your body. It's amazing. I've known at least a dozen people who have done it. It is an expensive protocol. Insurance pays for it. I think it's like $50,000. Wow. All right, so Hep C, there's a treatment plan for that now, so it's not as devastating as it used to be. Hepatitis D, must already have Hep B, okay. Hep E, you don't hear much about hepatitis D and E. That's also fecal oral route, like A. Fatty liver, right? When your liver, maybe from a diet that's too much trans fats, just poor fats, builds up in the liver because the liver stores it, and those portions of the liver that's storing all this fat become non-functional. So too much sugar, right? Could be from alcohol, or it could be non-alcoholic fatty liver as well. First thing that, if you see that someone's triglycerides on their blood test are really high, when I mean really high, I'm talking like 200, okay? If you're familiar with what the numbers are, where we'd want to see it like under 100 for triglycerides, but if it's like 200 for the triglycerides, you might be concerned about a fatty liver. And the first line of defense is what? You send them for an ultrasound. To see, and they can tell on the ultrasound if there's a fatty liver, but also on the blood test if they have very high triglycerides. And those liver enzymes will probably be high, okay? Cirrhosis, okay, well, if the Fatty liver progresses, then part of that tissue dies, and that's pretty much what's happening here. You're getting scar tissue that's totally non-functional tissue. Again, they can do ultrasound to look at that. AST and ALT are your two key liver enzymes. Their common values, which is really good, would be like around 20 for each of those. If they start, getting up to 40, that's kind of an issue. And those go high when you're just using any kind of prescription drug too. So it's not just an indicator that there's cirrhosis. It tells us those liver enzymes that the liver is struggling, which means you should maybe go for further testing, like an ultrasound. And then liver cancer, right? And that causes progression of cirrhosis. Okay, now, so shouldn't happen as much from Hep C because we do have treatment for Hep C, but when we talk about alcohol damaging the liver, turning it to fatty liver, turning it to cirrhosis, and turning it to cancer. And I'm just going to mention this because this is important. Anybody comes in and says they're taking a lot of Tylenol. That's acetaminophen. So that is very toxic to the liver, very toxic to the liver. So Tylenol. So if someone comes in and they say, oh, I'm on Tylenol, I take 3 a day, you might want to really educate them on the dangers of taking too much Tylenol. Gallstones, we kind of talked about this early on. I don't need to talk about it anymore. You can read through that. We kind of talked about the different types of blockages and how to get that gallbladder working. And if they have gallstones and get their gallbladder removed, we want to make sure they're using some kind of support, ox bile and digestive enzymes. Acute pancreatitis, inflammation. And what is the pancreatitis? I mentioned earlier on what would be a cause of it. Blockage by a gallstone. Right? Gallstone blocks the common duct between the gallbladder and the pancreas. They come together. Gallstone blocks it. The digestive enzymes that are coming from the pancreas back up into the pancreas and start breaking down the pancreas, causing irritation, and you get inflammation. So we get an ultrasound, check for that gallstone. And pancreatitis that does not resolve, right? And just like the liver, you get, if you're constantly irritating something, you're getting scar tissue, and scar tissue is not functional. And diabetes can develop if the beta cells are affected because those beta cells make what? Insulin. Okay. All right, so let me go over here. Let me finish this here with what I call is, what's the basic approach? If someone comes in and they have a digestive issue, it doesn't matter what it is. It could be anything that we talked about here. Okay, anything that we talked about. Is you need to have, in depending on what you do, you may only do oral medicine and may not make any comments about nutrition or other things. I don't know how each person is going to operate, but you need to have a standard protocol. You need to say, well, what am I going to do in this case? And you want to keep it pretty basic. And you can tweak it for whatever pathology they might have, right? There's different tests, right? Maybe there's a few different supplements that can be supported, but you need a basic plan, right? So I'm going to give you my basic plan. Someone comes in and they have a GI issue, anything that's on this list, all right? What's going to happen? Well, number one, we're going to clean up their diet. We're going to make sure they have a diet that's, I would say, whole foods. Lots of good fats. Good fats are what? Anti-inflammatory. So lots of omega-3 fish oil. And adequate protein. Why? We need adequate protein because protein is the building block for everything that we're going to be trying to fix. Okay, so clean up the diet. Number two, we're going to check the thyroid. We're going to make sure the thyroid is functioning optimally. You maybe have the history, you know that there's a lot of stress. Well, let's check the thyroid. It could be out of balance. If the thyroid's out of balance, None of the cells in any of the organs that we're talking about here are getting the message to do what they're supposed to be doing. The liver's not getting the message to do what it's supposed to be doing. HCl not being released from the cells because the cells, those receptors, every cell in your body has receptors for T3, that active thyroid hormone. If it's not getting, those cell receptors are not being filled up with adequate T3, the cell's not working at 100%. Maybe it's only working at 50%. Right? So optimize thyroid function. And we need to check, very important, TSH, free T3, free T4, and reverse T3. So that's a whole lecture about, well, what do those values mean? And the relationship tells us if the thyroid's working correctly. Third thing, make sure, I mentioned early on, check oral health. Make sure that they can chew food and break down food. And there's no infections. They're not introducing bacteria into their bloodstream through their gums, through infections in their oral cavity, okay? Add betaine HCl with the meals. So they're eating a whole foods diet. They take a couple bites of food, take a betaine HCl, maybe 2. You determine whether how much acid you think they need. Add digestive enzymes. So before they eat, I'd have them take a digestive enzyme, get that in first, then start eating, then take betaine HCl. I would add a probiotic, a quality probiotic, and more importantly, a prebiotic, or make sure they're eating some fermented foods like sauerkraut, kefir. I don't know about yogurt. That's a little bit weak. I need something a little bit more stronger. So I would say sauerkraut or kefir. All right. And then in between meals, this is very important. We want to make sure we heal the intestinal lining. So we want to use some glutamine powder. You mix it with a little bit of water, half a teaspoon in some water, and you want to drink that maybe 2 or 3 times a day. All right. And that coats the stomach and small intestine and acts as a nutrient for the cells lining the stomach. Okay, that's my go-to. You can add aloe vera if you want. There's other things that can be supportive, but glutamine is my go-to. And if you do that intensively for about 30 days, that's all you have to do it, and those cells repair themselves within a few days. Support the liver. Okay, make sure I mentioned the NAC, whey protein, olive oil, milk thistle. Stay hydrated, right? We want to make sure the food is moving through, so we want to have lots of water. With the whole foods, make sure you're including some fiber in there. If you want to take a fiber supplement, that'd be fine too. A little psyllium, or better yet, ground flax. Sprinkle it on some of your food. Deep breathing, stimulate the vagus nerve, right? Very important. Work with reducing stress. So that's where your counseling skills come in. You can say, well, what's bothering you? What's going on? You want to reduce stress. And there are supplements for that, by the way. My go-to product I'll just mention is phosphatidylserine. Phosphatidylserine. Or it's abbreviated just PS caps. Most companies have a product that's just called PS. But phosphatidylserine, and that modulates cortisol levels. And then find out how they're sleeping. So fixing a lot of these things will help with sleep, but if they're not sleeping, you have to do what you can to fix that sleep. So fixing the thyroid will probably help that. Doing the phosphatidylserine will probably help that, right? And then having just better nutrition and it will probably help that as well. So that's the program, right? You make it unique for the individual, but those are the steps you have to go through to approach any of these GI issues. So hopefully that's helpful. We can go through that in more detail if you guys need to in a class period or not. All right, so this was the end of video 3. This one was a little bit longer, 45 minutes or so. So thank you for listening, and we'll put together the other videos and we'll just see how this goes. So thank you so much. Have a good day.